Okay, well, I am very pleased to welcome you all back for our final speaker and the final keynote for what has been an incredibly thought-provoking and inspiring day. I wouldn't say have been numerous take-home points that are very meaningful. And in our final slot, we are very fortunate to have Dr. Robert J. Blendon here to share with us his predictions concerning where we go from here after a robust discussion where we are currently. And to introduce Professor Blendon, I'd like to tell you that he's a graduate of Marietta College. He is also a graduate of the School of Business at the University of Chicago with a master's in business administration. In addition, he holds a doctorate degree from the School of Public Health of Johns Hopkins University, where his studies were focused on public policy and health policy. Dr. Blendon is highly accomplished in these areas, in diverse areas at that, but he is also quite humble. When I asked him which of his many accomplishments he would like, or he might like me to emphasize during this introduction, he submitted a very streamlined biography, which didn't mention most of his many, many contributions. Nevertheless, Dr. Blendon, while being humble, is still the perfect speaker for today's symposium. His unique career and areas of expertise have established him as a true leader in the area of health services research and public opinion and policy. He is a member of the National Academy of Medicine and of the National Academy of Sciences and of the Council on Foreign Relations. Professor Blendon is a former member of the advisory board to the Disease Director for the Centers of Disease Control and Prevention and a former member of the editorial board of JAMA. He was also a past president of what is now the Academy of Health and a winner of the Distinguished Investigator Award. He was awarded the Baxter Award for Lifetime Achievements in the Health Services Research Field and the John M. Eisenberg Excellence in Mentorship Award from the Agency for Healthcare Research and Quality. Professor Blendon has also received the Mendelsohn Award from Harvard University and the Warren J. Mitofsky Award for Excellence in Public Opinion, research given by the Roper Center. Dr. Blendon is supremely qualified to lead this presentation on the future of the intersection between medicine and politics. Please know that you can enter a question. Those in the audience can enter a question at any time in the Q&A, and I will try to bring them to Dr. Blendon's attention. And there will also be time for a Q&A at the end of his presentation. Please join me in welcoming Dr. Blendon. We are most fortunate to have you here with us. And thank you again to the Center for Medical Ethics and Health Policy for this collaboration with the Center for Professionalism. Dr. Blendon.
Thank you very much for having me. And I hope that I can be helpful in what is a very difficult situation today. In the world of medicine, which we've been discussing, has become more politicized. And it affects a number of issues. This is not an academic discussion strictly, that people in this audience care a lot about. And so what I want to do is in my own view, to be helpful to you, I want to present in my interpretation the broad forces I see that are leading to the politicalization that we're discussing today. And they are mostly external to medicine and something I watch very closely. Then secondly, I want to just take a few minutes to talk about the election as a backdrop for the politicalization issue in medicine. Those of us in professional schools like to pretend these elections don't affect what happens to us, but it is impacting a lot of the discussions that we're going to have over the next few years. And thirdly, with a great deal of humility, I'm going to make some recommendations about where we could go from here to reduce some of the level of the politicalization that we are facing today. First, just some quick background if you are not a follower of the political world. Over the last decade or so, Congress and state legislatures have become more politically polarized, a term that people use all the time. What that means is when you interview them, more and more people, if they're Republicans, say, I am conservative. If I'm a Democrat, they say I'm a liberal. The people in the middle are teaching somewhere at the universities for that. And so you really see this huge division. The second thing is, particularly over the last decade or so, and the first slide just shows you that, social issues. The Republicans have, this is self-identified, become more socially conservative. In earlier years, Democrats moved in the other direction, socially liberal. Well, what does this mean? This means that the one party is more socially conservative on racial equity issues, gender issues, abortion, guns, religion, education, immigration. The other party on the same issues are more politically liberal. Why do I even mention that? Because it turns out in both parties, the social issues are more important in the political process than they ever were before. And so parties used to mostly disagree over economic issues and government spending, but now they incredibly disagree over these very difficult social issues that we face. And universities and schools are caught right in the middle of these debates. The third thing is, if you're a teacher, this is very hard to explain, but the political system quietly changed. What's happened is that when members are elected to the Congress or state legislature, they now pay almost exclusive attention to the view of their own party's voters, not to the general public as a whole. So I'm in the polling world and I say 58% of Americans believe this or that, or people in Texas for it. That has no relevance. If the Congress is Democrat, what matters is what Democrats believe. If the legislature is Republican, it's what Republicans do. How does that affect your life? Over half the states are currently living in one-party states, regardless of what we think about competition. That is, the governor and the legislature are all the same party. And so those political actors pay attention to the views of their own participants, not the public in general. And so I will be highlighting how Republicans and Democrats see some of the issues that we talk about differently for this. But the social issues have become more important and they are highly split for this. In recent years, if we can go to the next set of slides, we've seen a decline in trust in public, in medicine, medical scientists, public health, and higher education. And so what I want to show you, and this is very sensitive, but you have to understand this, is if you look at the decline in confidence in medicine in the public, what you see is, if you look at it by party, yes, it's gone down, and we all talk about the public this or that, but it's dramatically gone down among people who identify as Republicans for that. So if I'm in a state where the governor is Republican, the legislature is Republican, this has real implications for me. And I want to be very careful. I'm not going to be academic here today. I am not interested in public trust as a discussion for some academic seminar. Basically, public trust in real life provides a shield for institutions from political interference. When the public trust level goes down, it sends a signal to people in politics that they can get involved in universities and medicine and institutions and everything, and they'll have a lot of public support to do it for that. So you watch this number not because it's an interesting academic number or we presented some seminar. It's when it actually goes down very low, it brings out political forces to suddenly discover they're talking about your curriculum, your education, your this, your that programs. And just 2 years ago, they weren't discussing it at all. So the shield has been coming down with us. If we can look at the next slide. So there's been a decline in medical scientists' trust over just recent years. If you go to the next slide. Next slide looks at it by party, and let me just be frank. So just go to the bottom set of bars. What that essentially says is the moment 1/3 of people who identify as Republican in the United States have no trust in medical scientists. Not a little, some, none. So I'm on TV trying to give some advice on cancer. And I'm going to tell you there's a share of your audience that just is not paying any attention at all. Democrats are maintaining, even though it's declined, a higher level of trust in medical scientists. But Republicans have really grown very skeptical about that. They believe there are other agendas that people in academic medicine have. Let's take a look at just the world of public health coming out of COVID. Next slide. So you can see what happens is that in the COVID era, confidence in the CDC went down by 23%. Confidence in the FDA, which was lower, went down by about 6%. But go to the next part of the slide and you can discover today confidence in this. No, go back to the next slide, thanks. Confidence in the CDC is 22% for Republicans and 67% for Democrats. For that, confidence in the FDA is 51% for Democrats and 28% for Republicans. And so I'm on a retreat with Republican House members. Their discussions about CDC and the FDA are going to be very negative in the next few years. And they know this. Their constituents just don't feel very, very good about this. Let's go to the next one, which is also very worrisome. Next. So this asks the question, looking ahead. We've got COVID. If there is another major pandemic, how much trust do you have in the public health institutions to deal with this thing? 65% of people who are Democrats say, I trust them. I think they can handle whether or not it has to do with cows or this or that or something like that. I believe they can handle it. And 11% of Republicans say they can handle it. For that, this has real implications when people start issuing advice about what they do, when they talk about funding in the future, everything else. These things have very real implications. Let's look at higher education just for a moment. Next slide. And what you can see is confidence in higher education went down in recent years. And go to the next slide. But it went down among Republicans by 37% and by Democrats 9%, which means if I am facing a state legislature that's Republican and I'm president of the university, I could find myself in some very negative conversations. Less so in a more democratic state, but the decline in confidence is very real, and it affects how the political actors, in fact, respond to you. So I want to switch just for a minute or two to the election. But before I do, again, I want to reemphasize, I only am paying attention to trust because it turns out in real life it's a shield for political actors not involving yourself in the university or schools or professions. Let's just quickly take a look at the background of the issues in the upcoming election, which for many of us are too much of today's news. But it's very helpful in just thinking about the environment you're in. First is, and just to show the oddity here. If you're in my field versus you're an economist or this, you have completely different results. In my world, the mood of the country is very pessimistic about what's going on. There are all kinds of numbers in the news about this is positive, this is up. The people that we survey are incredibly negative short term. Secondly, they are focused only on their own families. And for many of us concerned with really serious problems, at the moment, when you actually interview people, they're not paying a lot of attention to other people's problems. They're paying attention to the problems of their own family. And I'll return to this later. But they're seeing the world through my problems of what I'm dealing with today and my family and my parents and everything else. They're not looking at broader issues that are facing the country. If you look at the top issues, inflation it has been the dominant issue. And by inflation, I mean very practically, we're not talking about economic seminar. We're talking about people telling you that the prices they pay for food, housing, gas, consumer goods, and healthcare have really gone up, and they can't keep up, and it's a problem with them. Over the last year, immigration passed healthcare as a top issue as if it was winning a horse race. Healthcare was over here, was like 3, and suddenly just immigration as an issue has just moved forward. Healthcare is 4 or 5 as an issue in this election. And let me say something about abortion, which is incredibly important. It's a different type of issue. And so when you put it on a list, it's not necessarily at the top, because people answer the question as a personal issue, not as an issue facing the country. So if we look at the next slide.
Dr. Blendon,
Yeah.
could you please check your volume on your computer, because your voice, everyone wants to hear what you're saying, and sadly your voice is a little bit muffled. And if you turn up your volume, perhaps that will address this, so our audience will catch all of your important comments.
At the moment, the computer says I'm at 100%.
Okay, so we're trying. Thank you.
At another time, we can have a discussion about Zoom and American life.
I'm all for it.
Yeah. Let me get a little bit closer. Is that any better?
Yes, that'll probably help. That's another suggestion. If you get closer to your microphone, that might.
How's that?
I think it's a little better.
All right, let's try the next slide. What you see is that essentially 23% of voters say that abortion is a personal issue, and they actually could vote on it as the dominant thing in the election if they believe that something's really going to be decided in the election. Otherwise, they go back to one of their other concerns. So the abortion rises when there's going to be a law that's going to be passed, something's going to be really changed. People say, I have to vote on this. I can't let this just go by. But otherwise, it doesn't show up. It's a second or third level issue. But it will play out if it's identified in this election as being critical. Let's go to the next slide. Let me put this simple, and I'm going to return to this about where we go in the future. At the moment, in a world where people are talking about the prices of what they pay, regardless of the problems that faced in medicine and healthcare, affordability, a price that I can't pay for, is all people say. When you interview them, what are the problems? What do you want done? What do you want the president to do, the senator to do? I want them to do something about affordability. That's just the dominant issue. at the moment in the healthcare field. For that, if you go to the next slide, what's the top health issue? And 10 years ago, I would have told you it was cancer, and we'd have a war on cancer and everything else. It's now opioids and fentanyl, followed distantly by obesity and mental health. So these, when we get into what are the health issues that people worry about, we actually have a totally new set of issues. And opioids and fentanyl is really all over people's discussions, which 5 years ago, I didn't have it on a slide for that. So that's changed the discussion about health. I just want to take a minute or two. When we talk about elections, people always talk about specific just issues, but they're values, and it affects medicine that are playing out in this election. And I just want to go over them. So the first is, when you interview Democrats, they think the federal government's not doing enough and want to spend more money. When you turn around and interview Republicans, they tell you the federal government's spending too much money, and it's the leading reason we have inflation today for this. So in two separate rooms, one say, here's this problem, spend more money, we have to do this. The other room, no, spending money is the reason why I can't buy food. We have to reduce federal spending in the next few years. Similarly, the role of government in solving problems. Democrats say we have an unbelievable list of problems, and the federal government has to do more to solve them. Republicans say the federal government is too much in our lives. It's too large. It's too big. It's too invasive. We have to cut it back. In terms of federal versus state role, which really matters, Texas and the U.S., Democrats just think major problems have to be solved by the federal government. Republicans more and more want states to make a decision and let them decide what happens, which affects, if I'm in medicine, who makes the decision externally? Is it the federal government or is it the state? When we come to universal coverage, this is simple. Democrats just believe they can't agree on what it should be, that the government should make sure everybody has a health insurance policy. That's their job. Republicans think that's not the role of government. They should not be out making sure people have health insurance. That's not their job. In terms of the Affordable Care Act, which is a low-ranking issue in this election, Democrats are very fond of it now and want to enlarge it if the election wins. Republicans are not fond of it, and they don't want to repeal it, but they really would cut it back if they had a choice. In terms of racial equity, which is a very sensitive issue, but important to realize, when you give people a list of 17 critical priorities facing this country, Democrats have as one of the top priorities dealing with racial equity in this country. It really is, has to be done. Also, ask the question, have we done enough? The answer among Democrats is no, we have not done enough. I now go into the Republican room and ask the same questions. On the list of 17 priorities, it's at the bottom, racial equity. In terms of have we done enough, we have to do more. Republicans say we just have done enough. Time to move on. And the reason why I mention this is, as someone in the polling world, the people I survey wouldn't know DEI 5 years ago if they ran into it. They would think it was a mechanical problem. And suddenly it's being discussed as if this is a burning issue. Although it's a burning issue because of the values issues that have shown up. And the last thing, let me just say something about Medicare very quickly. I think it's obvious to the audience. It's not obvious to people who work in Washington. Medicare and Social Security are the two most popular social programs in the United States. And they are seen totally different by people who don't live in Washington. So Medicare and Social Security are seen as programs for me and my parents. I pay for them my whole working life. They're there for me. They're not for somebody else. I get my own number. And as a result of it's for me and my parents, the majority of Republicans do not want to cut Medicare. and the majority of Democrats don't want to cut Medicare. And so there is no polarized difference. Now, in this election, if a candidate decides that they're going to cut Medicare, they're going to be sorry, and they'll be at one of our seminars for help for that. But basically, we may face the financial problems in the future, but Medicare and Social Security are in a different category. People feel very differently about them. So I want to switch to what the subject of the conference is about. Where do we go from here? And I am going to be extremely humble and a lot of humility here. A large number of political scientists have reviewed the issue, what do we do about declining trust? And again, the trust issue is because it's a shield. It's not because it's an academic field of study. And what they discovered is there have been commissions, group forums, everything else to raise public trust over the last 20 years, and they have not been very successful for that. We've done all kinds of things to raise public trust and confidence and everything else, and it hasn't worked. And so we tried it with higher education, we've tried it with the media, we've tried it with government, we've tried it with big business, and this declining cynicism just stays there. The only institution that deliberately and effectively changed public trust over decades is the U.S. military. And so the U.S. military actually went up, and there's been a fall after withdrawal from Afghanistan. But generally, where everybody's going down, they're the only ones that went up over time. And it was not by accident. They did a number of deliberate things which appeared to have had an impact. So I'm going to make some suggestions here for the world of medicine with a great deal of humility. It is in the interest of medicine, and here I want to be very careful that we separate out individual physicians from the institutions of medicine, because the poll results are different. If I ask you, do you trust your physician, the levels are actually quite high for it. The minute I talk about medicine, institution, medical system, anything that's institutional, that's where it declines. So I'm going to make some suggestions, and I'm making, again, I want to reinforce this because it is the interest, if you are in a leading role in medicine, of wanting to have a shield against political interference in the future. I think it could get actually a lot worse than your conference today has been discussing. For that, you need to restore some sort of public trust. So I'm recommending, with some humility, some steps. So first is, I think that the medical establishments should have a very visible role in being concerned about people in all communities who are very ill and cannot get care. My example is the backup all across the country in emergency rooms, where people are very aware of this. And it's not that physicians don't talk about it. You don't have organized medicine saying, over the next 5 years, there are 5 things that we have to do. It's going to change what's going on in emergency rooms. You don't have to get treated and sit in overnight and everything else. We can fix this. And to pick 2 or 3 other things where people are seriously ill, but I'm very specific about all communities. It's important, if we're going to deal with the political issue, to show that we're concerned where people, they're living in rural areas and inner cities and minority communities and in suburbs, and they have some medical problem that's very serious and it's not getting treated. And people in medicine are speaking out publicly, not only about the problem, but doing something about it. This is what we need to do. So people walking around with this don't keep walking around with it. And you're really seen in the news, testifying before the legislature. This isn't a small little conference where we put out a one-sheet release. We're talking about taking very real stance. The second issue that I can see very clear from surveys has to do with medical misinformation. That is, it turns out the public is aware through the social media and everything else that there's all types of information, and they're actually scared. They don't know what to do about things to do. And so I grew up where we said, well, that's the job of the scientists in Washington and Atlanta to solve. And I'm in a world where survey respondents say, I just don't trust them now. I can't rely on them to tell me what I should do. So I think leaders of medicine should pick up on a small number of things that really threaten their patients. We're not talking about becoming consumer reports here. We're saying a small number of things that really affect patients and taking a very visible stand. This information is dangerous to you and your family. For that, and really be seen taking on the real risks for that. And the last is a very sensitive issue, and if people want to turn their screens off, I understand this. The leading concern people have is, I can't afford the care I'm getting. There must be some issues where leaders in medicine could come up with ideas so it's less expensive for patients in the future. They could pick the ones that they can live with, but be seen actually advocating, you don't have to pay what you're paying. You don't have to have this happen. You don't have to have these kind of bills. You can get a follow-up somewhere else. But actually taking some stance would say, I know you can't pay for this. It's really a problem for you. We are trying to figure out some ways that it's not expensive for you. So I'm going to end this. These are the three again, going after some very visible issues across communities where people can't get care, serious medical information, and acknowledging people have trouble paying for care. Can't the leaders of medicine say something about fixing some of these issues? And so we're going to take questions in a minute. But again, I want to emphasize, I am only raising this because unless you can raise this shield of public trust again, and if I was talking to university presidents, I would say the same thing. In medicine, you're going to find interventions politically that are going to make you very uncomfortable. Things that they should not be discussing. They shouldn't be in the middle of your educational program, but they are. But in order to say you shouldn't be, the audience has to say, I trust you. You work this out. You're in charge of figuring out what's best here. I trust you for that. Rebuilding that is really important. So that's what I'm closing with out of this is that if we want to move away from the politicalization of medicine and not have this conference 5 years from now, we have to find a way to rebuild trust in the profession, having a broader public interest and fighting for people in a sense of the word. Let me quit. I'm open for any question, acknowledging that I admit that my colleagues haven't found the cure for this problem for a number of years.
Well, thank you so much. I want to say that it was wonderful that you ended up with some three specific areas where that are practical, that we could address, because to be honest with you, as a well-intentioned and earnest person who wants to make the system better, sometimes I feel so overwhelmed and helpless in terms of moving the needle in the right direction. So I was fascinated by a lot of the data that you presented, and it's very wonderful that you have data to present to us. I'm wondering, did any of these findings that specifically surprise you, and what do you think would surprise the public out of the information, the data that you presented just in this brief talk?
So the biggest thing, if you go back to my work 5 years ago, the differences between political parties was not as great. And this actually is quite alarming, which means the outcome of an election changes the whole environment for medicine and higher education for this. And we're used to 5 years ago, we always talk the public this and the public that. And now I'm in a world where I have to look at the partisan differences because they're extraordinary and people in politics are acting on those differences. Things happen in Texas that would not happen in Massachusetts and vice versa.
Mm-hmm.
For that. So that's one of the surprise. And also the sharp decline in scientists, given the rate of very impressive discoveries we've had over the last decade, is surprising. If you go and watch the conferences of what's happened in this and that and cancer and everything else, there are impressive changes in science. And then I'm here telling you that a third of people don't trust anything the medical scientists say. I mean, so that the fact that you can have these real advances in medical science and find people so skeptical is very worrisome, which means the output of the journals doesn't directly necessarily affect how people on the turnpike are thinking.
So the underlying distrust is so disappointing and so distressing. And the problem is that when people try to clarify it, no one trusts the people who are clarifying it. So it's sort of like we need to start a few steps back in order to maybe affect this type of change. I'd like to hear do you have any other constructive things that would help us feel optimistic?
Again, I want to back up what I said before.
Yes.
At the moment, people are very concerned about the problems in their personal lives. My view to people at institutions is take on issues that directly affect a lot of people's personal lives, that they're worried about, they're talking about their parents, their this, their that, their kids, and you're addressing a very real problem they have. And they suddenly are listening to you because they're talking about this real problem at home. Don't give them lectures about why you should trust me. For that. But people are having real problems with illnesses, with paying bills, with getting care, and to directly talk to them, but not in some abstract way. We see this thing, we are making recommendations to try to change this. We absolutely hear you, and we are going to try to get things so your life changes. That's where it is. But when you back up and you say, I'm going to get involved in this, the first question you say to yourself, they are sitting at home talking about the problems facing their family. Are you dealing with the problems? For that. Secondly, and this is hard for my students and everything else, a large number of people who are distrustful did not graduate college. So things that we say, normally scientists say, well, they're not as reliant on what scientists say. And we had a scientific panel and they said, well, if I don't trust one scientist, why do I trust seven? For that. So I encourage people to explain what the science actually found. For this, we think this treatment, even though there are risks, are better for you. And let me explain to you why it's better and what we found. Don't tell me that scientists at the FDA approve this. That doesn't reassure me if I don't trust them. So it's really explain what is it that they saw that led them to believe that this really could help my mom or myself or this, and explain it to them. And stay away from statistics and stay away from scientists say, but try to explain exactly. For those in family practice and general practice, I can hear them saying already, Bob, I do this already. I have to explain to those people what it is that we actually found. I just can't tell them that somebody at the FDA approved this and I'm going to get this. I have to really work them to understand why. And so it's really important to be seen talking to the fact that a large number, and they have to do people who run for office. I have to just remind them the majority of voters didn't graduate college. And I teach PhD seminars. And I have to go from one room to back to a room of talking to some people running for the Congress. And their audiences are not the same.
I had the opportunity to review some of your slides before your talk, and I thought I saw a couple of areas where there was sort of bipartisan alignment, and obviously there aren't too many of those, but I'm wondering, are there ways that you think that we can kind of enhance this ability to have some kind of bipartisan movement or alignment that could help move things in a positive direction? Because, it feels very discouraging that, like you said, that the Republicans care about their voters, their own voters, and aren't that interested in non-registered Republicans, and the Democrats are mainly interested in the Democratic vote. So how can we get people to cross the aisle, or I don't mean, if you have these answers, I'm going to give you $100.
It's not easy. So at the moment, the one I recommended, but it's not working out that way, was opioids and fentanyl. It's the top issue for both. But it turns out the party said, thanks, Bob. And one is running on immigration. And if we only stopped immigration, and the other is setting up treatment centers for that. I'm hoping someday that they can have a joint discussion because there's bipartisan support for that. Some of the issues that I suggested, Republican and Democratic communities have overflowing emergency rooms. So there's some issues that you could take on that directly affect people's lives. And that's why for the political side, I'm very interested in being involved in all types of communities. Some suburban communities have problems, rural communities, minority communities, absolutely. But be seen that you're addressing problems that exist in multiple communities, that allows you to have a broader audience.
The problem is, I think that there are issues that have involved broad communities, for example, gun violence. And I don't see, even though it's affecting everyone, I don't see people saying, this is enough. We just need some common sense, realistic approach to this, because everyone's families are at risk and everyone is living with fear. And I would, in my opinion, in a way, that would seem like one of the most obvious shared interests that we could possibly come together on, when you see schoolhouse shootings and that type of thing. And yet we haven't, people are just digging down deeper on their own sides. I'm disappointed. I'm worried.
You absolutely should be worried. The problem is that someone in my world realizes it's much more difficult than a health and medical issue, because this issue of an individual right has taken hold in communities, and they're just unwilling to discuss the issue about the consequences of the level of gun violence for that. And so it's really, I have students and faculty colleagues that end up yelling at me because I say it's going to be very difficult, and they say it's so obvious for that. So I discovered that mental health, providing services, etc., doesn't have any of the party resistance. So you go beyond not fentanyl opioids, but you find both parties willing to have clinics and schools that do screening, have online calls to turn out more mental health professionals. So mental health, I discovered, was an area that doesn't have this deep-seated, polarized partisan barriers. But I apologize to everybody. My role is to look at these issues and see if for some reason they're so politicized we can't really move forward, or is there something here? But there's no scientific explanation for why issues are politicized. You can't in any way say, what's the evidence for why you hold these beliefs? People do. There are conflicts over religion that are emerging, and it's the same thing, and you're not going to easily win them having discussions here.
So I think I've alluded to the fact that I'm feeling, besides worried, I'm a little discouraged in terms of the the lack of bipartisan ability to cooperate and look for the common good. And so I'm a little discouraged. I'm sort of embarrassed to admit, but I'm discouraged. I'm curious, what keeps you optimistic and what keeps you engaged in the fight? And when you can if you can identify what that is for you, can you give us some ideas of things that we can do practically to try to move the ball forward?
First of all, if you had 7 academics with my interest in the same room, they'd give you 7 different answers. So I want to be careful here. I am more optimistic because I think politics is cyclical. I am not as pessimistic as many about the future of the country. I think polarization, like infections, can go away. I'm hoping we have a vaccine that works sooner than later. But I don't think, I think there are problems facing this country that could bring people back together. For that, I tend to focus on wanting institutions outside of government to take on more public problems than they did before. And they are because the negativity towards governments, particularly federal government, is so high, and this election is not going to help for that we have problems, and it would be helpful if professions, universities, unions took some public stands on issues to try to deal with real problems that weren't as just dependent on Washington helping. But the answer to your first question is, I do believe it's going to be cyclical. I've said this about other things. I don't think this is a trajectory where nobody trusts everybody and every issue is partisan. But I think things have to go. One of the things that has to change is the combination of COVID and inflation have made people very family-oriented, very worried, very negative. Their lives were disrupted. You're interviewing people and they're telling you their kids aren't doing well in school. They had to change schools. And in those discussions, it's very hard to get people to talk about broader issues. But I don't think this is, we will recover and we will go on. But in the short term, we are going to have these issues. And I think independent institutions have to think some about the public position of trying to give themselves strength to keep the political process out of their lives.
The audience has another question. Why do you feel that universities and academic health centers may be hesitant to take public stands on health-related issues?
First of all, I mean, in the university and health centers and everything, people are involved in huge research enterprises. They're involved in specialized treatment. They're involved in training people, and they're not focused on dealing with the public domain. And it has not seemed to be very critical. Why do I have to worry about these things for this? And I would not recommend this just because it's some sort of amusement that people should do. But I'm sitting here, and as I watch these numbers go down, I can predict what the next state legislator hearing is going to be about, or congressional hearing. And so I think it's a problem of...
Could you repeat that, please? What did you say? You predict that the next...
And so I watched public trust in the major universities, particularly among the Ivies, go down, particularly among Republicans. And so I was not surprised to find a congressional hearing where Republican leaders attacked Ivy League presidents. Many of my colleagues were just shocked. What role does the federal government have to do with determining whatever policies universities have? But when the trust levels among Republicans, it literally is in a negative level for a number. There's just an antagonism against some of the Ivy League schools among Republicans. It's cost, it's elitism, blah, blah, blah. And as the numbers go down, they do that. And so they're going to have to worry about dealing with these external audiences, like it or not. And that's one of the issues that the university leadership has, is that's not their usual worry. Why do I have to care, except the Congress funds us for something or other, what they think about what we're doing? But in this era, when the trust levels get low, and so, but if you were there, I would advise you have to worry about having some level of public trust to keep the Congress out of your university and your school.
Something that you brought up surprised me. I was really happy that you had all of the survey data and sort of scientific data explaining what the Republicans think and what the Democrats think and all of that information. And I thought that would be very useful in making cases for increased activism for better health, more universal health care or something like that. But your point was that you think today the public isn't interested in what a panel of scientists say. So may I ask you, how would you present that information? Because I think there's still some people who care about facts, right? I don't know, but how would you use this information if you don't want to attribute it to research or to scientists?
So, and this is really appropriate to clinicians, and I gave some visibility to this in my apologies here. For audiences that did not graduate college, stories about individual patient lives have very powerful effects. So I was in a number of news stories supporting a intensive care physician statement, which I wanted to give her an award, which got carried very widely. And she's in the ICU with a patient who is dying from COVID and wants a vaccine. And she explains to him it's too late. Well, that showed up in 100 newspapers, and people who I surveyed could understand what she was talking about. There was a single case, it was an individual case. And clinicians is very good. You don't have to get people's names or everything else. But if you can talk about examples of individual patients who had particular issues because they didn't take a step or this didn't go. And so my view with the insured is the world I do, and we do a number of our own surveys on problems of uninsured, are very important, and they capture what I call the graduate school audiences. But for people in the middle of rural Texas, it's a story of somebody who was turned away from a Texas hospital because they didn't have insurance. And why didn't have insurance? Because they were between jobs and this other guy. But it's understanding that these things happen and they have real life consequences for that. And it's just this audience just responds to some individual, and we have statistically just, and again, I'm with this all the time, statistical significance or this or that, you can't do that. But I realize for somebody who wants to know, who graduated high school, what's the direction of the country is, my telling them about the variant, the statistical significance isn't very helpful.
That is such a good point. Actually, Dr. Brandt put in the chat, data can change some minds, but it takes stories to change hearts.
Yes, yes. And so physicians are uniquely qualified to do that. But it's unbelievable. I am a data person. That's my whole background. And I'm running around telling people to tell stories. And so, because the audience that's so distrustful just can't take a study in the Lancet said, you have to go further. You have to give some example of patients who benefited by what the Lancet study said.
Well, that's a really outstanding tip, and I mean to kind of refocus our efforts. And earlier in the day, they were talking about advocacy and how clinicians or different practitioners can have contribute in terms of advocacy. And I think patient stories, I think every one of us have patient stories that illustrate points of lack of access or vaccination issues. So that's a powerful tidbit that you've shared with us. And let's see, Dr. Rose has asked whether there are some platforms that you think that we should, as clinicians, be seeking out to tell our stories that might be the most impactful on the greater public.
So I have to be apologetic here. If my graduate students were on this call, they would say Professor Blendon knows less about those platforms than anybody in the Western world, and we have to help him understand this. I'm still with CBS News for that. So, but you absolutely need monitoring of the platforms and the audiences. I mean, I'm just at the level, say, to remind you the people who are most hostile to scientists are more likely to watch Fox News and read the New York Times. My students say, no, let's talk about what social media site they're listening to. But it's very important to have people who are monitoring the audiences for social media. But this has just not been my strength.
I think on NPR, I recently heard of a study that they did where they had individuals who usually watch Fox News watch CNN for 6 weeks. And it was interesting to see the limited impact it had, but it did have an impact. We have a very short, this time has really flown by. I'd just like to ask people in the audience, this is your last chance to have a question before we are going to end this wonderful day of interesting topics. So if anyone would like to enter a question or a comment in the chat, here is your chance. And I personally want to thank Dr. Blendon, as well as really everyone involved today, because the conversation was extremely thought-provoking and actually very practical. Specifically, Dr. Blendon, I feel indebted to you for some of the points that you've made. They're kind of making me rethink several things. So that was really wonderful. So thank you for actually another comment from Dr. Rose. Thank you for your thought-provoking work in this very complex arena. I always think that, when you said the problems that impact people in their everyday life, the issue is that there are so many, when I listen to people wanting preschool education and preschool breakfasts, I'm like, yes. And then when I hear about people who want to help the elderly, I say yes. And then when I hear, there are just so many competing valuable aspects to public health and medicine that it's very hard to stay focused and really make a positive difference. But I deeply appreciate your insights.
So let me just say the critical issue is finding a few things that are really identified with medicine, and not that there's a problem, that you're actually proposing solutions. You're testifying, you're talking about audiences, about what needs to be done here. So people have a sense that, yes, they have a problem, and you're, as an institution, are trying to do things that actually will impact that problem. So that's careful. I have 100 interests, but at the end of the day, which one of those institutionally am I actually active doing something about?
Thank you. That's an excellent parting thought. I really appreciate your thoughtful approach to all of this and your insights. And I would now like to welcome back Dr. Amy McGuire, who will give us some closing remarks.
Okay. Wow, what a day this has been. Thank you to those of you who stayed on with us for the duration. It was really interesting to delve deep into the intricate nexus where medicine and politics intersect. So I think today we've explored the complexities, challenges, and opportunities that arise when these two worlds collide. And I know that I learned a tremendous amount. I hope that we can each carry forward the insights we've gained and continue this important work together. Before I send you on your way, if you have some time, I strongly encourage you to please join us virtually to view posters from our Baylor College of Medicine students in the health policy pathway. Using the link, there should be a link in the chat to VoiceThread. If you have Firefox or Chrome browsers, those are the preferred browsers and might make it easier for you to log into VoiceThread. So like our program today, the posters cover a range of really fascinating ethics and policy issues that our students have explored over the last year or so. Some examples include nutrition education curriculum in public schools, physician responsibility for implementing climate interventions, nonprofit hospital charity care programs, medication continuity following release from correctional facilities, and many more. The students worked really hard, and we're so happy to showcase them and their work as they prepare for graduation. We also kindly ask that you take a moment to fill out our event survey, which you can find in the chat also. And this will be sent to you in a follow-up email since you registered to participate in today's symposium. Your feedback is greatly appreciated and it will help guide our future events. So thank you once again for your participation and support. Ellen, thank you for your co-sponsorship of this outstanding event, and we hope to see all of you soon. Thank you so much.
Thank
Bye-bye.
you.